Drugs used to treat eye disorders such as glaucoma, conjunctivitis, herpes simplex infection, and injuries can be mixed with inactive substances to make a liquid gel or ointment so that they can be applied to the eye. Liquid eye drops are relatively easy to use but may run off the eye too quickly to be absorbed well. Gel and ointment formulations keep the drug in contact with the eye structure longer. Solid inserts, which release the drug continuously and in slow amounts, are also available, but they may be hard to put and keep in place. Ocular drugs are almost always used for their local effects. For example, artificial tears are used to relieve dry eyes. Other drugs, for example, those used to treat glaucoma, such as acetazolamide and betaxolol, are used to dilate pupils, such as phenolphthalein and tropicamide, produce a local effect after they are absorbed through the cornea and conjunctiva. Some of these drugs then enter the bloodstream and may have unwanted effects on other parts of the body. If a drug is to be breathed in and absorbed through the thin mucous membrane that lines the nasal passages, it must be transformed into tiny droplets in air or atomized. Once absorbed, the drug enters the bloodstream. Drugs taken by this route generally work quickly. Some of them irritate the nasal passages. Drugs that can be taken by the nasal route include nicotine for smoking cessation, calcitonin for osteoporosis, dihydroergotamine for migraine headaches, and corticosteroids for allergies and asthma. Gases used for general anesthesia, such as nitrous oxide, are given by inhalation and not exhalation. Drugs given by inhalation through the mouth must be atomized into smaller particles than those given by the nasal route, so that the drug can pass through the windpipe or trachea and into the lungs. How deeply into the lungs they go depends on the size of the droplets. Smaller droplets go deeper. Inside the lungs, they are absorbed into the bloodstream. Relatively few drugs are taken this way because inhalation must be carefully monitored to ensure that a person receives the right amount of drug within a specified time. Usually, this method is used to administer drugs that act on the lungs, such as aerosolized anti-asthmatic drugs in metered dose containers. Cutaneous route. Drugs applied to the skin are usually used for their local effects and thus are most commonly used to treat superficial skin disorders such as psoriasis, eczema, skin infections, viral, bacterial, and fungal, itching, and dry skin. The drug is mixed with inactive substances. Depending on the formulation, may be an ointment, a cream, a lotion, a solution, a powder, or a gel. Some drugs are delivered body-wide through a patch on the skin. These drugs, sometimes mixed with a chemical such as alcohol that enhances penetration of the skin, pass through the skin to the bloodstream without injection. Through a patch, the drug can be delivered digoxinally, slowly and continuously for many hours or days or even longer. As a result, levels of a drug in the blood can be kept relatively constant. Patches are particularly useful for drugs that are quickly eliminated from the body because such drugs, if taken in other forms, would have to be taken frequently. However, patches may irritate the skin of some people. In addition, patches are limited by how quickly the drug can penetrate. Small daily doses can be given through patches. Examples of such drugs include nitroglycerin for angina, scopolamine for motion sickness, nicotine for smoking cessation, clonidine for high blood pressure, and fentanyl for pain relief. Other